Hello, I am Dr. Nidhi Bhatnagar Harjai. I am a speech language pathologist, and today I am going to be discussing a very important aspect which the parents can keep in mind while they are trying to stimulate the children and provide them adequate speech and language environment at homes. So now often we see that when we tell our parents that you need to stop the digital exposure for the child, and the child has to stay away from the television, the iPads and the mobile phones, even at times when you're feeding the child or you're trying to make the child a little more calmer and the child is getting very hyper or very anxious. So often we do get this feedback from parents that ma'am, we have tried certain other things and the child is now not looking at the mobile, but he is paying attention to a different thing. Now that different thing could be numbers, that different thing could be pictures, it could be different kind of toys, it could be different kinds of cars, it could be different kinds of items for different children. Some children might be fascinated by cars, for example, or they might be certain children who are more fascinated by, for example, small little models of dinosaurs. Similarly, they could be children who are more fascinated by numbers. So today I'll be taking the example of numbers and I will be trying to describe to you that how when we are removing the obsession or the compulsive behavior of watching a mobile or trying to look at the mobile, when we are trying to take that away, how you can generalize a new concept but at the same time not let the child again become very compulsive about that new concept. So say for example there's a child who has now very limited access to the mobile or the iPad and now generally has a lot of affinity or is showing a lot of response in a positive manner towards numbers. So as parents, what are the things that we can do to generalize the concept and to expand the concept? So say for example, there was a child who used to look at the phone and take his meal along with watching some cartoon or something on the mobile phone. Now the mother has put away the phone and is feeding the child, and instead of the mobile phone you are now using something like numbers. So when you are saying a number, say 472, you're writing the number down, the child is focusing on the numbers and he is eating and doing both the things simultaneously. Do you think is it a positive improvement? Is it a step towards the positive direction, or is it two steps towards the positive direction and then a U-turn back to the same journey? Because only the stimulus has changed. Instead of the mobile phones, now the fixation has shifted to numbers. So you need to understand that by removing the fixation of one item, you cannot fixate your child to the second item, even if it is something as harmless as numbers. So if you feel that your child is being fascinated by numbers, you have to ensure that you do not keep repeating the same activity very monotonously with the child. Otherwise, we are knowingly or unknowingly again putting him into the same vicious unwinding circle of fixations, whether it was a mobile earlier and now it is numbers. So say for example, this child is fascinated by numbers and you want to do some expansion activity, or you want to understand that instead of just saying number names like 472 and then you would write another number and say 562, how to expand on numbers. So instead of something which was taking place over a paper and a pencil with the child sitting adjacent to you, make the helper, the father, the attendant, any other family member, take the child and go at a distance from where the primary therapy giver or the primary therapist is sitting, and from that position try to encourage multiple activities on the way as he tries to come and finally want the mother or the therapist to say that number. So say for example, if the child is standing with the father or with the attendant at a little distance, then on his way from that point to the point where the mother or the therapist is seated, on the way, he has to do certain items. For example, you can keep cards which read 1, 2, 3, 4, 5, and after the fifth card, the mother is situated or the mother is seated there. And on number 1, there is an apple. On number 2, there is a ball. On number 3, there is a basket. On number 4, there is a comb. On number 5, there is a spoon. So the child has to come holding the hand of one parent to number 1. Where they come to position number 1, the attendant or the father says, "Oh, look at this. This is 1. 1 पे क्या रखा है? या what is kept at number 1? This is an apple. Let's go to number 2. Number 2 पे क्या रखा है? Number 2 पे this is a glass. Let's go to number 3. Number 3 पे क्या रखा है? Number 3 पे this is a basket. Let's go to number 4. Number 4 पे क्या रखा है? Number 4 पे it's a ball. Let's go to number 5. So previously what you were speaking were just numbers 472, 562. That you have expanded and you are now speaking numbers, single digit numbers, and you are associating them with an object or a toy or an item, and you're speaking in complete sentences. So when the child covers that distance from 1, 2, 3, 4, 5 and reaches the therapist or the mother or the therapist asks the child, okay, tell me child, what was kept on number 2? What was kept on number 2? Now you are asking a question, a number is involved and an object is associated with that number. So the child is going to give you a blank look, does not know what to call it because he has not developed the vocabulary. So then the primary therapist or the mother takes the child's hand, goes back to card number 2, asks the child to recognize कि number 2 कौन सा है, ये वाला है कि ये वाला है. So the child goes and points to number 2. Yes, that's right, this is number 2. और number 2 पे क्या रखा है? This is an apple. Number 2 पे क्या रखा है? Apple. And then go back to the seat and make the child write number 2 on a piece of paper or on a small whiteboard or a blackboard, or maybe paste the picture of a sticker of an apple or a picture in front of number 2 where the primary therapist is seated. So you need to learn to expand your child's earlier primary learning into something which can be used for converting it into vocabulary or functional language. So make sure you are not repeating blind numbers and just increasing the digit span of the number. Like initially it was 5, now he's able to recognize 25, now he's able to recognize 255. So now I'm going to make it 255. Say we're going to progress to make it to 2355. It is absolutely senseless and useless to do that because the child is not picking up any language, he is not picking up any vocabulary. What you need to do is to pick up that concept which he is enjoying, in this particular case that of numbers, and try to associate those numbers with items and objects which are relevant, which he is going to use on a day-to-day basis. It could be items of clothing, it could be general utensils, it could be some favorite toys, it could be pictures of family members. So that is up to you how you want to do it. So this is one activity which you can start doing with the child and see how the child is responding, because we do not want to take him out of one vicious cycle of fixation with the mobile phone and then step into another vicious cycle of roundabouts where we are dealing with numbers. So you need to make sure that proper expansion is taking place where you are adding vocabulary, you are adding functional language and associating that with a number and increasing the complexity of the activity based upon the child's age. You cannot blindly restrict the activity to just reading out numbers. So make sure that eventually the end product, the reinforcement or the happiness that the child derives out of doing that activity is actually going to be the number in the end. So step 1, step 2, step 3, step 4, step 5, main therapist, and then at the main therapist, where the main therapist or the mother is seated, there you have a bigger chart or a whiteboard or a blackboard where the child does one fine motor activity like pasting or maybe a magnet which he has to put up in front of number 2 and make an association. And this is going to involve a lot of muscles, a lot of big muscles of the body. This is going to use a lot of gross motor activities. It's going to use a lot of fine motor skills. So this entire process, this entire activity, you have worked upon his gross motor skill, his fine motor skill, his activities of daily living, his functional vocabulary and communication. So make sure that when the child is being removed from one concept that he has fixated on and you're moving to a new concept, make sure you are expanding and generalizing that concept very rapidly and quickly. Otherwise, in no time, you will be fixed up with another fixation for the child. So I hope this was helpful. And if you need any more feedbacks, you are most welcome to get in touch with me. Thank you.